immediate health risk from the new virus to the general American public is low at this time.
We think we have it very well under control. We have very little problem in this country.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Disease Control and Prevention is confirming the first case of human-to-human transmission in the United States of the novel coronavirus.
We pretty much shut it down, coming in from China. We have it very much under control in this country.
Now increased our assessment of the risk of spread and the risk of impact of COVID-19 to very high at global.
It is not necessary for Americans to go out and buy masks.
Right, it's not going to do anything.
But anybody that needs a test can have a test.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
As of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world.
Last 2 minutes that the NBA is suspending the season. I say that understanding.
Today I am officially declaring a national emergency.
There's a recognition of our interdependence that requires of this moment that we direct a statewide order for people to stay at home. That directive goes into...
None of the nurses are wearing masks, not even surgical masks, in the hallways when they're giving report to each other.
It's a tribute to the amount of testing that we're doing. We're doing tremendous testing. And I'm sure you're not so much, but they have to go back to work. Our country has to go back. Our country is based on that. But this is voluntary. I don't think I'm going to be doing it.
For this virus, don't you need a nationwide testing system for the virus before you reopen?
We have a great testing system. We have the best, right now, the best testing system. Injection inside or almost a cleaning. As you see, it gets on the lungs and it does a tremendous number.
Is wearing garbage bags, mask shortages, overflowing hospitals. These are the images you see coming from hospitals in America.
Tonight, Connecticut joining the rest of the nation, the last state to begin its first phase of reopening. Shopping malls,
recommendation is when you're out there, particularly if you're in a situation with this active infection, keep the distance physically.
The U.S. recorded its highest daily one-day total with more than 36,000 new coronavirus cases.
I think that at some point that's going to sort of just disappear, I hope. Mortality rates, I think it's the opposite. I think we have one of the lowest mortality rates in the world.
But this is the first time that the pool, the White House press corps, which gives the media to the public, has had access to President Trump in a mask.
On the pandemic. Now, according to Politico, the administration has been interfering with the CDC's scientific reports on the virus.
This as the death toll in the U.S. tops 200,000, the highest in the world.
Tonight from America's top agency in charge of containing the spread of coronavirus over what to tell Americans about how the disease can travel.
Here they're calling it the apocalypse, and this is what it looks like.
With the country on the verge of seeing over 10 million infections, on Sunday 100,762 cases and experts warn hospitalizations are rapidly increasing. 56,000 people are now hospitalized, with 10,500 people in intensive.
Against that new strain, vaccines. But the Trump administration promised to inoculate 20 million people by year's end, falling far short. This morning, a highly contagious strain of COVID, first detected overseas in England, has now turned up in this country for the first time. It was found in a Colorado man in his 20s who had not traveled.
This morning, predictions of a deadlier new year are now a reality. The nation setting a new record this week of more than 4,000 deaths in just one day. The deadliest day on record. Hospitals sinking deeper into crisis, preparing to ration care as needed medical supplies like oxygen are running dangerously low. With healthcare workers overwhelmed, the National Guard is moving into other hotspot locations like Mississippi and Arizona to help administer vaccines